brought to you by the Dao Health.
This is Delve, a podcast that endeavours to enlighten and support you in understanding and transforming your own health.
Hello, my name is Elizabeth Cullen and my co-hosts are Clarice Berry and Molly Burton. And together we will be drawing on the Dao Health's signature and unique integrative approach to traditional Chinese medicine.
So take a seat at our table, grab a tea, and let's dive deep into the enduring legacy and evolution of medical practices over time.
This episode of Delve is proudly brought to you by Flow Women, your go-to for postpartum recovery essentials. Founded by a women's health physio, by mums, for mums. Flow Women offers everything you need to heal, rebuild, and feel strong again, from high-quality women's health products to recovery guides and evidence-based education. Visit flowwomen.com to start your recovery journey with confidence. Thank you so much to Flow Women for making this episode of Delve possible. Hello and welcome back to Season 2 of Delve podcast by the Dao Health. How are we all?
We're good.
We're great.
We're back in studio.
Excited to be back here.
Yeah, it's great, right? Now, to set the tone for this episode, let's start around the table. What postpartum meal are you making a loved one post having a baby, Molly?
Oh, I always love a really yummy, hearty stew or lasagna.
Yep, love that.
Wow.
Straight to the soul.
That would be very appreciated.
Yes.
Love
All right, okay.
that.
Put your orders in now.
Yeah, I'll take the lasagna any day.
How about you, Clarice?
Well, from a vegetarian standpoint,
True.
I was
Sorry.
vegetarian for 6 years. Obviously, we advise patients if they are meat eaters, like get in your collagen, get in your iron sources, because you really need that postpartum. But a really hearty pumpkin soup recipe would probably be what I would go for with all those root vegetables. And if you can do a little bit of bone broth in there, if you're not too worried about that,
nice. Yeah,
that would be
idea.
nice to build in a bit more collagen as well.
Yeah, beautiful. For my friends who've had bubbers, I usually make them the postpartum soup. So from our traditional Chinese herbal medicine soup blend. And then for my veggie girlfriends, I usually make it, but without the chicken, and I usually put mushrooms in.
And you put tremella.
Yeah, I can put tremella in.
Love that. Yeah, that sounds great.
Yeah. So, alrighty. So let's get into the postpartum practices dynasties. Okay. So the dynasty of postpartum practices in Eastern cultures are often rooted in traditional beliefs, and many emphasize rest, specific diets, and social support to help new mothers recover from childbirth. These practices vary widely across countries and regions, but share a general focus on balancing the mother's physical and emotional well-being. Countries where postpartum practices are still encouraged today are in China, Japan, India, the Middle East, and Southeast Asia. Now, postpartum practices have historically been lacking in the West. No surprise there, unfortunately. Although awareness has slowly increased over the last decade, with Sydney's first postpartum wellness hotel opening in 2024 in Double Bay called Born Wellness. And in Melbourne, there is a postpartum hotel called Home, which also offers preventative care for families. So we can include those in the links. Now, China's postpartum practices are acknowledged throughout the world and have a strong connection to traditional Chinese medicine. The practice of Zuo Yue Zie, excuse my pronunciation if that is incorrect, otherwise known as sitting the month or the first 40 days, is recognised culturally as well as in traditional Chinese medicine. Interestingly, TCM has played a role in gynecology and obstetrics for thousands of years, and in obstetrics was first mentioned in the Ming Dynasty in 1368. Now, we polled our listeners on this one and we asked, are you aware of Zuo Yue Zie or the first 40 days? Now, 57% of our community said yes and 22% said no. So I think this is going to be a really useful podcast for some of our listeners.
Definitely.
Yeah.
But I'm also really happy to see that at least 50% have said, yes, I do know what that is.
Yeah,
Like, there's more
super cool,
awareness
right?
of that now.
Oh, definitely. It's definitely grown.
As we talk about it, the fourth trimester.
Yes.
Fourth, yeah.
Yes. Yeah. So the first 40 days in TCM is one of the 3 golden opportunities, along with menarche and menopause, for women to be cared for and supported to heal and actively improve their long-term health in regards to future fertility, menstrual cycles, and menopause. The first 40 days are crucial for the immediate and future health of both mother and baby. It is a time to rest, recuperate, and be supported. The practice is traditionally known as sitting the month, the fourth trimester, the first 40 days, and also Zuo Yue Zie. Originally, sitting for a month was what a mother in China would do post-birth. She would be confined inside in her home, away from the wind and cold, limiting socializing and encouraged to rest. Traditionally, the new mother would be supported 24 hours a day with meals, massage, and abundant support with the baby, and there'd be very firm rules that she would be resting.
Yeah.
Her mother or mother-in-law would observe her to ensure she's following these guidelines and therefore ensure her recovery and future longevity. Sitting the month is still encouraged culturally in China, with fourth trimester support available in a confinement hotel where baby comes along. From a TCM, or traditional Chinese medicine perspective, childbirth causes significant depletion in a mother's body with a loss of qi, blood, and jing. The body and mind need time to be cared for to enable healing and replenish what has been lost. Breast milk in traditional Chinese medicine comes from the foundation of blood and qi, responsible for breast milk to flow smoothly and to function efficiently. When there is not enough qi, or if the qi is unable to circulate properly, breastfeeding will be affected. From a physiological perspective, a female will experience the most significant changes hormonally and physically from birth into the postpartum period. So we can't take away from that. And I think that's interesting from a Western perspective, that this wasn't a time that really was given much attention.
No. Yeah.
As the body adjusts to restore to a pre-pregnancy state, rest is vital to ensure she feels supported through this time to heal. During the phase from childbirth to postpartum, the new mother will experience the highest level of the hormone oxytocin, which is produced for a prolonged period. Creating an oxytocin-rich environment through nurturing and caring for the new mother provides space for her to rest, heal, and connect with the baby through spending time together and through breastfeeding or bottle feeding. Now, as we attempt to implement this practice into the West for all of its benefits to the new mother, to lay the foundation for her postpartum experience, this can arrive with barriers such as societal pressures and expectations, although slowly the conversation is shifting. And today we're going to deep dive into practical ways to practice elements of the first 40 days. So often we see the focus on planning for birth. So our last episode of season 1 was all about birth prep, and we can see how much time is given to that. Interestingly, we polled our listeners on this one and we asked, did you plan ahead for your postpartum recovery? Now, it was about 50-50. So 56% said yes and 44% said no.
Yeah. Okay. We got to improve those stats.
We've got to improve those stats, because we need to be mindful again that labour really is only a day to 2 days. Postpartum is for a minimum of a year.
And then for the rest of your life, you've got that child.
It sets us up for future menstrual cycles, future pregnancies, but then also into menopause. So it's something that we highlight heavily in the clinic and in our appointments, but something that hopefully we're changing our perspective on and really harnessing, because it really does, set the woman up for the months to come and the years to come. And it is a really important part to, put all our energy into.
Yeah,
absolutely.
Prepare.
Absolutely. And, we talk about those 3 trimesters of pregnancy, but that 4th trimester really is kind of just like, oh, well, here's your baby.
Yeah.
We'll see you maybe once or twice, but you'll work it out.
Yeah. And I think there's so much emphasis too on like birth of the baby, but it's also birth of the mother. And that's a huge transition for her to undergo.
And it doesn't happen overnight.
No.
And we've come from a high of hormones, and then we've dropped off, like in terms of the hormonal shift is dropped off because baby's here. And then now our hormonal state has changed as well. So we have to also support that, because that comes with different things like symptoms and
we've got prolactin coming in, like a heavily amount to get us lactating and breastfeeding happening, which is like a huge emotional hormonal shift too. There's so many changes happening in your body. It's like taking like 100 birth control pills in one. Like it's so extensive what's happening in your body. So there has to be time to really replenish and repair your body.
And in the West, I think we speak about this first 6 weeks postpartum, and then, you go and get your clearance from your care provider and baby gets a check-in and it's like, well, hang on, not everything's smooth sailing from there. So you've still got your hormones kind of supporting you there, and it's not until that 4 months postpartum where things start to drop off as well. So it's recognizing that. I also think it's really interesting in the West, as awareness of postpartum in the 4th trimester has increased, it also has brought almost like a sense of glamorizing the first 40 days too. So there's a really fine line of like almost making it like, how do I sit the first 40 days in a really amazing way, or like kind of reaching for that perfection again in a different type of way. So it's a really fine line of being like, okay, well, we know what the trimesters of pregnancy are like. Let's see it in a really clinical way that is realistic for women to achieve. So I really want to get that across today as well of, you know, what are those barriers that people are finding that they can't sit the 40 days, or what did they find was hard about it? And also, what are some really practical ways that you can use this at home?
So with the first 40 days, we need to adapt to the modern world that we live in now. We're taking the principles of traditional Chinese medicine and the first 40 days, but we're bringing that back into our Sydney homes, for example, here in Australia, and adapting where we can to optimize this time.
Yeah, and our personal circumstances too.
Yeah, how much support do we actually have at home? You know, is there family around? Is there friends around? What's your network like?
Yeah.
So I guess let's talk about some common challenges that women face in adopting traditional Chinese medicine practices during the postpartum period. And how can these challenges be addressed? So maybe before that, we should actually like talk about what TCM practices are. That we recommend for patients. So I think number one would be an acupuncture treatment. So ideally coming in as soon as possible after bub is born, for when you feel ready and comfortable, so that we can support post-birth recovery. We can unpack your birth story. We can do central nervous system support. Most of the time, it's the first time that you've had a moment without baby as well. So it's nice just to have a moment to reflect on what's happened over the last few weeks. And just making very clear that a postpartum treatment will look different for a woman who's had a vaginal birth or a C-section, but it's important that both births are supported and treated postpartum.
Yeah, definitely.
We also like to use moxibustion as well to warm up the mother post-birth. So once again, like Liz just mentioned, whether you did have a vaginal birth, we use a technique called mother warming, where we'll use a moxa stick and apply warmth across the abdomen. I did this yesterday in clinic and it was really lovely. Mother was on the bed. Baby didn't come along, but mum was there. We listened to a meditation together and I stood there and did the mother warming for her after a beautiful physiological birth. But then we also use moxibustion post-cesarean birth as well. We'll use distal points on the legs to boost up qi and blood and support circulation through the body.
Yeah.
At-home practices that we'd recommend, Clarice?
So nutrition is key. Chinese dietary therapy is really important. And that actually starts all the way back before you get into your birth prep. This would be doing your freezer meals. So making sure you're cooking up lots of meals. I always say just cook up double the portions of what you're going to have for dinner right now. Freeze those portions. And if you can, put bone broth concentrate in there, or save that to put in after. Have those freezer meals ready to go, so that postpartum you've got plenty of nutrients around you. Your time poor for one. Think about coming home from a long day at work right now, or just after your day's been chaotic. The last thing you want to do is cook. We live in a really good time of society where we've got access to Uber Eats and Menulog, and we've got food available to us. But I think when patients come in for those postpartum treatments, that's the first thing they say. They're like, I'm so thankful that I had so many meals already frozen, and family members and friends dropping over meals for them because they're time poor. They don't have a lot of time to be cooking.
And meal services like the dinner ladies as well.
Yeah.
I know I found that so helpful, especially when Pat went back to work as well, because it was like, okay, you've got witching hour. You really don't have any hands to be making dinner. So making sure that you've got a wholesome meal ready to go is just so helpful.
Yeah.
And also, especially if you're breastfeeding or recovering from birth, you need good food to be supporting you as well.
Yeah.
This is going to nourish our qi and blood and warm up the mother. So we always emphasize warming. So yes, rest is a really big key factor here, but then the second to that would be warming up the body. So that is popping some socks on, making sure you keep your feet warm, warm, keep your body warm, supporting through warming foods, warm water, all those practices just to really tonify and build up the qi and blood after going through a marathon of birth, whether that's vaginal birth or a cesarean, and then supporting coming into that breastfeeding phase as well. So continuing to nourish and rebuild.
Absolutely. And I think that's also where the Dao Health Chinese herbal blend soup also makes such a difference, that if you prepare that prior to birth and you put it into portion sizes so that you can have one bowl of that a day, it includes Chinese herbs that are going to nourish and support your recovery, support breast milk supply, and then also to calm the central nervous system. Yeah. And I remember the first time having that on the day of Harriet's birth and being like, oh, this just like, because I'd had it prior, like when I had COVID and things like that pre-pregnancy, but the taste of it, you're like, this is just absolutely nourishing my soul. So definitely having that soup. And also throughout your postpartum journey, if there's times where you feel deficient or, you know, your milk supply is starting to drop off, I found that I would just continue to have another batch of that. And I've started to recommend that for patients too. Most importantly is continuing to take your supplements.
Yes, I was going to say that. Yeah.
As well, taking your supplements and asking for help as well. You know, if friends and family are offering help, they mean it, and it gives you time to rest. So, Now, what are some common challenges that women face in adopting traditional Chinese medicine practitioners that we've come across?
Yeah, those practices, one, education's a big one. If you're not aware of what you should be doing postpartum, and our Western society for so long was like, how quick can you bounce back and get back on your feet and be back in work? And if you don't have that education around those Chinese medicine practices, it's hard to implement, of course. But I would say time, who's the village around you to come in and help with bub. If you're so flat stick off your feet, you're not getting any sleep, the last thing you're thinking about is yourself. You're always just thinking about bub first. And then, you know, we say rest when the baby's resting, but that advice is not great advice.
Terrible advice, because then you need to go and do the washing when you need to eat, or and it just puts pressure on when someone's like, oh, have you had a sleep today? And you're like, oh, I've kept the baby alive and I've fed the baby, but I've had a win if I've had a shower. Do you know what I mean? In those early postpartum days. Yeah.
I think as well, like if you haven't had the time to prepare the soup or put food in the freezer, you know, you can boil the kettle and create a bone broth, and that's a really nourishing thing to have when you're sitting, whether baby's having a sleep or whether you're just having a rest. You know, you can enjoy a nice cup of warm bone broth, which is going to support your kidney jing and your kidney essence and fill up your cup if you haven't, you know, had the time to do other bits.
Yeah, it's just doing something for yourself, whatever, how small that might be. All of it's accumulative. It's just taking one moment in that day to go, okay, what have I actually done for myself today? Have I eaten enough? Have I drank enough water for one? Sleep's always going to be out the window depending on what type of bub you have. But just think about stripping it right back. You know, you've got all these beautiful things that you could and potentially do from a Chinese medicine perspective, but just pick one thing that you can attempt to get on top of in that day.
And if that's keeping your feet warm, I think that's a great one too. You know, if there's ways that we can realistically implement the first 40 days, or say, for example, you have a shower, it's always like the best recommendation I can give is that once you get up, whether that's at 9 a.m. or whatever it may be, just go and have a shower and reset and change your clothes. But asking either your birth partner, if you're in a partnership, or someone who's a support person, that once a week you're able to wash your hair, you're able to even give it a nice blow dry, and someone's looking after the baby, and then your hair's dry and it also feels clean and you feel really good too. And that's an easier way to keep your hair dry through that period of time too. I think a big barrier to receiving acupuncture is if you haven't established that relationship with an acupuncturist prior to having baby, and also if you don't book an appointment. So I find like when you're pregnant, because I find patients who are like, I'll book it postpartum. It's like, yes, if you want to, but from my own experience clinically, if we can book it in, whether it be 2 weeks postpartum all the way up to 6 weeks postpartum, let's just book it in, because once it's there, you'll come. Whereas you'll get 3 months postpartum and then you'll be like, oh, I forgot to book that appointment, or it felt too overwhelming. Also not booking that week of the 6-week mark, because it's a really busy week that week, because it's usually when you have a baby checkup and then you also have a checkup for you, and there might be a women's health physio checkup as well. So I always say, block that week out, but let's go either week 2, week 3, week 4, week 5 or week 7.
Yep.
And let's get you in.
And I think Chinese medicine is always about preventative medicine. If you forget to book it in, the time that you do remember to book it in is when you're feeling pretty crappy and when you're feeling really depleted. So I'm like, just book it in as soon as you think you'll be comfortable. And then we can actually look at the body and assess at that point in time, like, oh, we are looking a little bit deficient in this. Like, let's see if we can boost this to prevent you feeling like you're at your absolute depletion point.
I often recommend, say, for example, if your partner has the paid paternity leave, so PPL through Centrelink, and they only get 2 weeks off, try and do it while they're still off, because then you've got the support.
Yeah.
You can breastfeed or bottle feed throughout the consult, and then they can take baby for a walk and while you have a rest. Or if you've got a support person who can do the same for you, just making sure that that's an option too. Or we have a wonderful reception team who also
love cuddles.
More than happy to look after your beautiful baby if you feel comfortable.
Definitely.
Alrighty. So, Clarice, you're planning on entering motherhood for the first time with your first baby. Mm-hmm. How are you planning for postpartum?
So my intention to go into postpartum is I would like to see if I can do that rule of 5 days in the bed, 5 days on the bed, 5 days near the bed, to give my body that adequate amount of rest that it needs. Preparation for postpartum, I am preparing my body for birth, so that's a big one. But we're doing the Born Ready course. So I'm doing that with my husband coming up in August. So that's going to be great for birth prep. Postpartum wise, I'm making sure that I've got lots of meals frozen. My hubby is used to be a chef. So like I know he's on the point with that. But even knowing that he'll be around and be a great support, and yes, he probably could cook every night if I wanted him to, I'm going to make sure I've got the food there, because I feel like that's the first thing that's going to go out the window when I'm run off my feet. I'm not going to have enough nutrients around, and I know that's going to lead me to feel really depleted. And then also just staying on top of my supplements as much as possible. I'm going to take that breastfeeding prenatal all the way through my breastfeeding journey, but also for the first year postpartum.
Are you talking about the NaturBest?
Yeah, NaturBest 2-3 breastfeeding formula, which we love to use in clinic. Yeah.
Definitely.
What about you, Liz?
So my experience for the first 40 days with Harriet was unexpected. So we had quite a challenging time with Harriet being diagnosed with a life-threatening condition when she was 6 days old, and she needed surgery at 2 weeks old. So we were the lucky ones and we were able to bring home a healthy baby after she'd recovered. But from a first 40 days perspective, obviously everything was kind of out the window. We were in a hospital setting. It was a high stress environment, and trying to implement the first 40 days at that time was difficult, although I was so thankful for the knowledge that I had through Chinese medicine and had planned for postpartum, because I continued to take my postpartum soup. I kept my feet warm. I kept my hair dry. And as much as it wasn't ideal, that also got me through to be able to keep breastfeeding Harriet when I was able to feed her again after she was out of ICU. So I think that's definitely something that I know the bare minimum helps to support recovery. But also what I learned from my first 40 days is if something does happen that's unexpected, either to you or to baby, firstly, I send my love and my strength to you, our listeners, because it's a really tough time, especially when you're trying to navigate being a new mum and parenthood, but allowing yourself the time to process what's happened through that time at a later date if you're not able to at that time. Because when you're caring for a baby who is sick or unwell or recovering from surgery, there's not much space for you. But making sure that a loved one keeps you accountable, that you do process that later on if need be. And there's wonderful support out there like Panda and Gidget. And if that's you at the moment and you're listening and you know that that's something coming up for you with your children, or you're pregnant and you also know that that might be part of the plan for postpartum, is that babies are more resilient than you can ever give them credit for. You as a mother are more resilient than you'll ever know. And we are so lucky in Australia with our healthcare system with children, because the public healthcare system is amazing. So we'll definitely include those links of Panda and Gidget. it. But from that side of things, I think, making sure you do those bare minimum things of like keeping the warming foods because it does help with your recovery. And then also the process of matrescence, I think that's also something that the first 40 days, like there can be a bit of an emphasis there on that you've become a mother and the mother is born. But I remember I was with one of my girlfriends and in the park, and we were reading, Jess Ulrich, those beautiful poems about motherhood. And she was like, have you heard of the process of matrescence? And I'd never heard of it before. And she was with her newborn and I was with my newborn, and we're crying these beautiful poems. And she's like, the process of matrescence is becoming a mother. And it's okay. Like you may feel that abundant love or you may not initially, but you start to connect with baby. But being a mother is, you learn a lot over time. And that's why I always think the first 40 days, yes, but postpartum, that full year, I really see postpartum as if you decide to breastfeed, postpartum is the whole way through. So if you decide to breastfeed for 18 months, then you're in postpartum that whole time because your hormones are still connected with your baby and you're still recovering as well. Yeah. So I'll put the link to that journal post I wrote about the process of matrescence because I think it's really interesting of, it can be some pressure there of being like, once the child's born, so is the mother. And it's like, oh, look, that process can take some time. I think what also I would bring into this postpartum is allowing the seasons. So it's so fleeting. The first time when you're in a season, it's like, okay, newborn life, but it doesn't last very long. It's so quick. And then the next minute you've got a toddler. So just soaking up those precious moments, but also knowing it's really difficult and hard and that's okay. It will pass, but also if you need further support, it's there for you and you're not alone. Yeah. I think that's really, really important to note. And then asking for help when you can. Yeah, with your support around you. Yeah.
I think it's hard when you're coming in for myself, like first time mum, I'd have no idea. Like I have a logical idea of what to expect postpartum and how to support my body in that way. But I have no idea what my journey is going to be like and how I'm going to feel and how I'm going to go from an emotional mood regulation standpoint with all my hormones changing. And so it is just taking it day by day too.
It's being open, I think, because from our experience, like I was open, but I also knew what I wanted to do with the first 40 days. And what happened with Harry, it was so unexpected and was such a shock to us that it's like, oh, wow, things can change literally within hours. So it's like being open, but also knowing that there's support for you, I think is so important.
Yeah. I think as well, like reaching out to the Panda hotline, I was only speaking with one of my postpartum mums this week and both her and her partner had engaged in that hotline. So for your birth partner as well, they can also reach out for that mental health support. And I think another great resource is the COPE directory. So if you don't have a psychologist or a counsellor engaged during pregnancy, but someone that you really need in that postpartum phase, especially with P&D or
if you've had a traumatic birth
or postnatal anxiety or whatever you're feeling, there's a great directory on there where you can pop in your location and it comes up with perinatal trained psychologists in your area that you can reach out to. So I think that's really important as well.
Definitely. And we'll include that in the show notes as well. Just to wrap up today's deep dive, we're going to discuss placenta encapsulation. So with the rapidly growing practice of placentophagy, thank you, Kim Kardashian, around the world.
Was it Courtney?
Or was it Courtney?
I think it was Courtney.
And probably Kim did it too.
Placenta.
Yeah. Anyway,
Kardashians.
Many assume that placenta encapsulation is a healthy and ancient practice that is connected to traditional Chinese medicine for postpartum recovery. Placentophagy is the practice of mammals eating the placenta of their young after birth. Now, it is important that we have the conversation today that placenta encapsulation is in fact not a traditional Chinese medicine practice for postpartum recovery, and there are no classical Chinese source or gynecology texts that recommend women eating their own placenta or any animal placenta for treatment in postpartum recovery. Sabine Williams is a researcher and classical medicine translator, and she states that there are no historical texts that encourage the consumption of placenta as a standard treatment for postpartum recovery as a medicinal substance. The health claims made for placenta encapsulators include include supporting an increase in milk production and a preventative treatment for postpartum depression. Now, interestingly, neither claims are based on valid current research and do not make physiological sense due to the inhibitory effect progesterone has on prolactin. Interesting. Research actually indicates that there's a negative effect of placenta encapsulation on milk supply, and further research is needed, and this practice should not be recommended for or encouraged for new mothers. Sarah Hollister, she's a lactation consultant, and she delves deeper into this research, and I'll share that in the show notes. Now, rather than consuming the placenta, through education and awareness, we can provide other options for mothers. So women often do take it very lightly. They're like, oh, and I'll just, do that with encapsulate my placenta because it'll give me the health benefits. So it's a conversation I always like to have around that 34-week mark of what the intention is. And another option, instead of eating or consuming the placenta, is honouring the placenta through a burial. So you bury the placenta with a tree. Now, hot tip, which I experienced, was I forgot, I didn't even think about it, to take a Tupperware container to the hospital. So I really wanted to bury the placenta and honour that and to say thank you, you're Harriet's first friend. So burying the placenta was important to me, and I loved asking the midwife to show me through the tree of life that's on the placenta. So Clarice, I highly recommend that if it's something you're open to, is having a look. But yes, you do need to take a Tupperware container to the hospital.
Or a bucket.
Make sure it's a large bucket, maybe an ice cream plastic tub would be worthwhile, because you're going to be popping that in the freezer.
Yep.
And it's, yesterday, literally in clinic, the patient was talking about how apparently her placenta was the biggest one of the day, and it was literally bigger than a dinner size plate.
Wow.
So
go girl, that's a healthy placenta.
Yeah.
So take a bucket, because the hospital for us found one, and we had to the midwife had to make it fit. So I highly recommend bringing a Tupperware container. That's a hot tip. Now we're going to get into our Dao Does, Dear Dao Does question. Interesting one today from a listener. So, sex after birth, feeling a lack of sex drive, exhausted and no libido, feeling very dry down there. So I guess food for thought, team, what's coming up?
First and foremost, hormones. If we are breastfeeding and also we are not getting our periods back, we're not ovulating, your estrogen level will probably be quite low, which we don't have a lot of vaginal lubrication happening. That's also from a hormonal standpoint, when we've got ovulation happening and hormones doing their general cycle again. Testosterone's also probably not there in high amounts, because prolactin, I think, can suppress a little bit of testosterone too. So that's probably contributing to your vaginal dryness, but also from your libido or sexual desire perspective, just on the basis of hormones. But I would say question 2 would be how far postpartum they are. Are they closer to the birth phase, or are they a year into this journey? Has
their period returned? Are they breastfeeding?
Yeah. What's the emotional state?
How's their birth?
How's their birth? What are the energy levels like? Have they got support? There's lots of factors here.
Are they seeing women's health?
Yeah, lots of factors here that could influence why there's a lack of sex drive, or, there is no libido.
Yeah, definitely. And have they seen a women's health physio? Because often if there's dryness from a vaginal perspective and they're still breastfeeding, then that can be quite expected because of the reduction in estrogen. But there's options around. You can use a vaginal estrogen cream if prescribed by a GP or a gynecologist, that can help with that issue, especially if that's preventing a woman who's wanting to participate in intercourse. But also that can, if sex has been painful as well, I think that's something, sex can be painful after childbirth as well, for a number of reasons, depending on the birth that you've had, depending on how your central nervous system is, and yes, with breastfeeding as well and hormonal changes, that making sure you're seeking support, because often if there's pain, then you can also then have a connection to a low sexual desire, because it can be fear about the pain. So a good place to start would be a women's health physio and a GP, I think.
Yeah, definitely. And just coming back to the energetics of Chinese medicine, obviously the kidneys we talk about associated with fertility, but it's also associated with the emotion of fear as well. And if we go to the birth trauma side of things, or even postpartum trauma, like if your body's in a state of overwhelm and shock, you're not going to have normal kidney function, and it's already a bit depleted because you've just had a whole process of growing a baby, pushing out that baby, making food for that baby. Your body's really depleted, but really looking into those mental health care services as well, just to assess everything and make sure your body's feeling calm and open to being intimate again.
Yeah, definitely. And if you are in those early stages of postpartum, to this listener, please take that pressure off yourself as well with sexual desire as, you know, all of these factors that we've spoken about, but also it's not expected that your sexual desire would be high at that time as well. You're already touched out with a newborn. So last
you
thing.
forget to eat.
Last thing, basic, basic human needs. So I think it's something that you are potentially in a season of winter as well with sexual desire and intimacy, and it will come back. But if those factors of what we've spoken about do resonate with you, then it's time to reach out.
Yep.
Alrighty, so from their team, we'll include those resources that we've spoken about, accessible support with Panda and Gidget, and those Dao Does journal recipes as well. So the Chinese herbal medicine soup, the Dao has a custom blend, so that is available online. If you're listening from overseas, then there's also a recipe online and you can go to your local Chinese grocer, just making it very clear that you don't have those Chinese herbal soups throughout pregnancy. They're only for postpartum. We'll include those Dao Does journals about matrescence and the golden month and sitting the month. And is there anything else you'd like to add before we finish up?
Oh, we'll just add the COPE directory in there too.
Oh,
that's really helpful.
Directory.
That's for Australia listeners only, unfortunately, but I'm sure in your areas there'll be something to engage in. I think that was
wonderful. Oh, well, thank you for today's episode.
Thank
team.
you. Thank you.
Thank you. See you later.
Bye.
Bye.
Thank you for listening to this week's episode of Delve and being a part of our community. Follow @TheDao on Instagram to vote in our polls and stay connected. Ask our team a Dear Dao Does question via the link in our show notes. And for more information and to sign up to our newsletter, visit our website.
The content provided on this podcast is for informational and educational purposes only. It's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare professional with any questions you may have regarding a medical condition.
Leaving a review on Delve helps others to find our show and increases awareness for women's health and traditional Chinese medicine. We would love if you can take a moment to like, subscribe, and share. This episode was recorded on Gadigal land. Always was, always will be traditional Aboriginal land.